Okay, cool. We good? Everybody? Fantastic. No more, well, you can take pictures if you want, but no more formal pictures. So I'm Noah Horowitz. I'm the CEO of Art Basel, and it is truly, truly amazing to see everybody here today and to welcome everybody on stage. This is a partnership many years in the making in many ways. We're welcoming here today the Jameel Arts Health Lab and its founding partners, the WHO, NYU Steinhardt, Community Jameel, and also Culture Runners, which Stephen has led and we've worked with in various capacities over the years. The Jameel Arts Health Lab is a hugely significant initiative that bridges the worlds of art, health, innovation, research, and really tries to forge new paths into learning and educating around the joint benefits of art, health, but in a research-driven way with these extraordinary global partners. Fadi, who's sitting here in the front row and was nervously taking pictures with us, is somebody I've come to know over the years as an extraordinary patron, philanthropist, and global citizen. And it is so cool, having known him for many years, really through his work in the fine art and culture space, to see this art and health collaboration and initiative come to fruition into a partnership with us here at Art Basel. So thank you, Fadi, and to all your colleagues for bringing this together and to doing it in Switzerland also, which of course is the headquarters of the WHO in Geneva. So there was a sort of natural and organic synchronicity, I think, to the timing of this and various conversations and the site here in Basel. Art and health is something that we talk about variously. Art and health is something that we're all broadly cognizant of, but I'm not sure that many of you in the audience, and certainly me, despite running this business and being a trained art historian, are real experts in. And I think it is beyond admirable to see an initiative truly bridging the worlds of science, health, and art, and to do something new that actually hasn't quite been done. And so the conversation that follows, which will be recorded and available online for all of you that aren't unfortunately here with us in person today, is really path-breaking, I think. In the unlimited sector, just next door, there's an extraordinary work from 1984 by Keith Haring. And for those of you that know Keith's work, he was an artist in New York in the 80s that was very involved in community, clearly, but also in working with hospitals and with health as an action point. And so it's somehow fitting that the most talked about work at the fair this year, which is this extraordinary work that he created and was taken down ultimately on the FDR, on an old highway, so public artwork, is a bridge actually in very literal terms to the thematics of today's conversation. So thank you so much for coming. I invite all of you to follow the Jameel Art and Health Lab on their various channels. And I'll hand over now to Christopher Bailey, who is the Art and Health lead at the WHO. And Christopher, over to you. Thank you. And thanks all of you on behalf of Art Basel and everybody here that's with us this week.
Thank you so much, Noah. Yes, I am the Arts and Health lead at the WHO, but also I'm a co-founder and co-director of the Jameel Arts and Health Lab, where we try to support efforts in research, practice, and policy to measurably improve health through the arts, through creative expression, particularly for the underserved. As part of our work, we have a multinational trial called the Home Project, where we look at murals in hospital settings and how they might create a healing environment and what are the measures for that. But I'm going to let my colleagues talk about that a little later. Instead, I'm going to talk a little bit about the underlying neurology of why we might say with some confidence it has a healing power. When our program first started, I embraced every aspect of it, of creative expression, from music to dance to theater. But the visual arts had a problem for me. My father was a painter. I grew up in museums. And when we started this program, shortly afterwards, I was diagnosed with terminal glaucoma. And although I have been passionate about the research and communicating the research of the benefits of it, there was a part of me deep inside that felt like there was nothing in that bag of tricks for me. But I have learned some fundamental parts of the basic science that might explain why it has such an effect. And to demonstrate that, I'm not going to use a PowerPoint because I can't see it. But my preferred mode of communication is dapper fashion accessories. So this is the wave, which you may have seen in the Metropolitan Museum of Art. It's a Japanese print. And I consulted an expert in neuroaesthetics named Carlos, who was about 2 years old, and I met him in front of the painting in a stroller. And he's looking up at the painting and concentrating on it. And what he's seeing is a two-dimensional surface with paint and colors and lines. And then at a certain moment, they all coalesce in his brain, and he sees a wave. And to mark that moment, he points at the painting and then turns to his mother for validation of what he just saw. And the mother instinctively mirrors back the excitement and the awe and goes, yes, it's a wave. And then he turns back and forth. And that moment of shared attention to a discovery in an object of art is critical to childhood development. In the midbrain, it reinforces the neural connections for empathy, for sense-making, and for social bonding. This is the foundation of visual thinking strategy. A few weeks ago, I was at the Rijksmuseum, and they were explaining their program in slow art, in visual thinking strategy, and the measurable benefits bringing some people together in front of art and sharing a patient experience has on people who are suffering from chronic depression, people who are living with dementia and other conditions. But even people who have no diagnosable conditions gather together now as part of this strategy to bond, to find a refuge from the chaos of their lives, and to recharge, to live their fullest selves. And beyond just living your fullest self, occasionally, in that deep aesthetic experience, there can be moments of transformation. Taking a negative experience and actually transforming into finding a personal meaning that allows you to endure, that allows you to thrive. For myself, it was in London when I was supposed to give a presentation at the Wellcome Trust, and prior to that, I decided to go to a midday concert at St. Martin in the Fields. And I was walking through Trafalgar Square, and it was so crowded I got disoriented and found myself washed ashore on the wrong side of the square in front of the National Gallery. And my heart sank, because I had been avoiding museums for years despite this work, because it was too painful to go inside and be with the paintings that my polluted, corrupt vision could no longer see. But to escape the crowd, I go in, and I find myself in this gallery with these monumental paintings, and I'm looking at them, and I'm trying to make them out, and I'm seeing images of storm and clouds and waves and ships, and I realize that I'm in the Turner Wing, and suddenly I can taste salt water. And I'm thinking, is that the ocean storm depicted in the painting? No, it was the tears streaming down my cheek. Because in that interaction between the vision of this artist long dead, the object that he created, and my own personal experience, I saw the way Turner saw the world, and it was identical to mine. And for the first time, I could conceive that the way I see the world could be considered beautiful. Thank you. Up next is my dear friend and colleague, Stephen Stapleton, a co-founder of the Jameel Arts and Health Lab, but it would be unfair after that story to hand it to him. So we're going to see a short video on the lab and then transition emotionally back to you. Thank you so much.
Great. Okay, it works. Thank you, Chris, who's gone. And I've also got a little fashion moment with my tie-dye blue socks to compete with Chris. So we're going to have a panel discussion now with these fantastic panelists. But before that, I wanted to do a little framing of the conversation. I also wanted to say happy birthday to Chris. It was Chris's birthday yesterday.
Oh.
And
Birthday.
And a thank you to Fouad, who's on his phone over there, who's been organizing everything behind the scenes. And to the WHO, which many of you might know, WHO is 75 years old. It finished at the end of May, but I think we can still say happy birthday to the WHO. I'd also like to thank the Open Mind Project, which is an organization which is supporting our Healing Arts program. And I want to start by just kind of recognizing that we collectively have all lived through the greatest health challenge to humanity in 100 years. And I don't know about everyone here, but I had an experience of art that awoken me to the health benefits of art during that period. This is actually a photograph by Antoine Degarta from a series called Virus, and it depicts people in a socially distanced queue, but it shows the kind of isolation. I started making art again during the pandemic after a 15-year hiatus. I found myself needing artists to help me make sense of what I was feeling, including artists that were documenting the pandemic. I saw artists working on healthcare messaging, like Mona Chalabi, and helping me understand how to wash my hands and what to do and to go through. I saw artists raising millions of dollars for the vaccine. Chris collaborated with Lady Gaga on the Together at Home concert that raised $180 million with literally a couple of months lead-up time. But I think most of all, I saw artists recognize that it wasn't just a physical impact of the virus, that it was affecting our mental health and our psychology. And there was a role that the artists played in comforting us, singing from the balconies, the Corona Quilt Project in India, Anthony Gormley's Museums at Home project. Was there any funding from governments for the arts? Not really. Did the governments treat artists and the art scene like poor organizations that needed to survive? Yes. But I think what's important is that this whole conversation comes out of that moment, and I think everyone recognized that the arts is very important, especially in this time that we're living in. So this panel emerges from the pandemic, from the establishment of the lab, from Art Basel coming on board as a partner. This is our first, we've been talking about it for a year, but this is our first kind of expression of that partnership. And as Noah, it's not good when the clicker doesn't work. There you go. Okay, I've got to hold it here. As Noah said, We chose the Keith Haring image as the representative of this talk, actually before we knew that there was going to be this giant Keith Haring in Unlimited, because the lab is working on the largest ever evaluation of the impact of murals in hospitals. This is in New York with one of our partners. But also, we started thinking about Keith Haring as an artist who, during the AIDS crisis, was actually doing extremely important healthcare messaging. You probably know all of those safe sex graffitis that came out, but he didn't do it in this scary, sinister way. He did it with joy, and it was obviously extremely effective. And I just want to highlight one artwork before we go into the panel, which is the AIDS Memorial Quilt. This is the most profound impact that this project had in the mid-'80s at the height of the AIDS crisis, where the government was not recognizing what was happening, this epidemic. And it took artists to express the public reality of a terrible epidemic. And this quilt, these quilts that were laid out on the mall in front of the Capitol building, which not only does each individual quilt offer comfort to those that have lost friends and lost family, but they also were this powerful advocacy, which no one's ever quantified it, but they probably did change the course of the political relationship to AIDS, and it started the opening up of the funding, which eventually led to the development of the research, which eventually led to the drugs which now make it not such a death sentence. So this project I always go back to because I just think it's so profound, and it transcends all these things that we think that art can do. Art can save lives, which we'll come back to at the end. So I'm going to just end before I go into my first question, which I'll ask all panelists, with one quote which summarizes what we're trying to do with the lab and with this collaboration, which is to bridge science and the arts. And last year we were lucky enough to have the chief scientist of the WHO came to speak at one of our events. We were terrified because we thought he would be so rational and he wasn't going to talk about art. And he said this in front of the audience. He said, "For too long, we have seen science and the arts as separate endeavors, but those silos were not always so. Through much of human history, the creative interface of different disciplines has been the catalyst for both innovation and healing." So that's Sir Jeremy Farrar, the WHO's chief scientist. So with that, I'm going to do a brief introduction to each panelist. So to my left is Dr. Nisha Sajnani, my good friend, co-director of the Jameel Arts Health Lab. She's also the founder of Arts and Health at NYU. Like all good academics, she has like 7 titles at the bottom of her email. So she's also associate professor and director of NYU Program in Drama Therapy, chair of the Creative Arts Therapies Consortium at NYU Steinhardt, and she's leading the Lancet Global Series on the health benefits of the arts, the Lancet #1 medical journal, and it's the first of its kind academic paper. Then we have Refik, who I met properly for the first time today, but we've been in touch for a long time, who you've seen his work outside at the entrance to Art Basel. And he's also the director of Refik Anadol Studio in LA and a lecturer at UCLA. He's a pioneer in the aesthetics of data and machine learning, working at the intersection of humans and machines. But I think what I've seen is that you've followed the technology as it's developed, as we're all spinning around as it's developing, and you're expressing it, and we're kind of understanding it through you. Debbie, who I have met again for the first time, or rather on Zoom, who is Hauser Wirth's director, senior director of learning, and she's overseeing all of Hauser Wirth's charitable and philanthropic projects. And as we'll see later, Hauser Wirth is really a lead gallery in not only looking at arts and health, but also in arts and all sorts of social challenges. And she's got a background in academia, which she'll speak about later. And Nathalie Bondil, who's been part of this kind of group as it's been developing, a French-Canadian museologist, currently director of exhibitions and museums at the Institut, monde arabe in Paris, and previously was director of the Montreal Museum of Fine Art, where she pioneered collaborations between the city, the museum, and the healthcare community for something called Museums on Prescription, which we'll talk about later. So I'm going to open the panel with a first question to everybody. I've got it here. I normally use my glasses, but I'm reading pretty good here, so that's good. So we're at Art Basel. We're at the center of the commercial art world, and we're talking about arts and health. What, to each of you from your perspectives, why is it important for you that we're talking about arts and health in this particular place at this time right now? Nisha.
Well, we're in a place where art matters. And as you've just been speaking about the pandemic, and all of us know before the pandemic, but certainly during it and certainly after, that our health is vital, health matters. And I think we're here to materialize vital matters. Vitality in the arts, vitality in our health. We're here to materialize that relationship.
I think art should be for anyone and everyone and any age and any culture. I do believe that we as artists can find the language of humanity, especially in a world where we have conflicts, wars, and separations, in a world where we have depression and anxiety. I do believe we have a profound impact as artists to create, to touch the mind and soul. And I think we are in one of the most important places in the world right now, all the leaders and people thinking and imagining and creating. I think it's a perfect place to think and talk about it.
Well, I'm here on behalf of Hauser Wirth, who have a booth here as a commercial gallery. Ivan and Manuela Wirth have always believed in the transformative power of art that Christopher so eloquently described at the beginning. And we believe that art can change lives. And I think it might be a surprise to some of you to hear that a commercial gallery has a whole department dedicated to learning and philanthropy. We have done so for quite some time. And Manuela Wirth herself has a background in teaching, as do I, as Christopher described. And I think on that note, again, I think to pick up on some of the opening comments, you know, we all had an education. We all went to some form of school or another, but we also all had life education. And when we learned our best, we learned when the conditions were right. We learned when we felt comfortable and safe. And I think if we can create environments where we feel comfortable and safe, everybody, regardless of their background, their age, their gender, has the capacity to experience things that they never anticipated.
And Nathalie, from the museologist.
Yes, in fact, I would say that it's not just about visual art or about museum. It's about human being. It's because we are 100% biological and 100% cultural. We talk a lot about artificial intelligence, but at the same time, there are so many researches about the emotional intelligence. And when we talk about the aesthetic emotion, we talk about art. It could be music, it could be visual art, it could be all kind of art, it could be nature. But this aesthetic emotion, now we know, thanks to neurosciences, has an impact on our brain, on our health, on our well-being. And this is why I think that art has a great role to play in such area.
Yes.
Okay, well done for the opening question and keeping to under your times. So Nisha, you know, a lot of people in the arts, me included, we have an intuition that the arts are healing, and we're calling our project Healing Arts. The arts community are not very good at quantifying that. They often will tell anecdotes and tell stories, but to really get into the science of it, could you just give a little overview of what is the evidence base for the health benefits of the arts?
It's a big question. I think that we are in a really unique moment because, as you said, we've intuitively understood that the arts move us. They matter to us. It's a vital part of human communication, and because it's a vital part of human communication, it's a vital part of culture, of how we understand and research culture, but that also means that it has a vital part to play in how we understand medicine and neurosciences, sociology, psychology, and we're at a point in time where we actually have the means to be able to measure that impact with greater precision. So I've made a couple of notes because to ask the question of what is the evidence, there's a lot going on. As you can see here, this slide really speaks to some of the areas in which we can see a measurable impact for the arts. And in 2019, the WHO Regional Office for Europe conducted a scoping review of some 3,000 studies that really demonstrate a relationship between receptive arts, so the arts that we view like we might do here, like a concert or a performance or an exhibition. So a relationship between receptive arts and health, as well as active or creative arts and health, the arts that we make together, right? We might sing together, we might dance together. And the benefits are numerous, psychologically, socially, physically, and because we're seeing these benefits, we have an obligation, I would say, to actually invest in research around how the arts might constitute viable treatment options, non-invasive, multimodal, non-pharmaceutical, or maybe complementary to pharmaceutical strategies for more holistic health and well-being. So I'm just going to point out just a couple of examples. So in the area of cancer care, for example, an hour of art therapy, some of you might be familiar with the creative arts therapies, and an hour of art therapy has been shown to meaningfully decrease subjective reports of pain, as well as scores for depression and anxiety. We can go to another slide. So in a 2022 study of over 4,000 older adults in the US, 1 to 3 hours of art viewing or making was associated with better memory, better executive functioning. And executive functioning is that set of skills that helps you get things done, that helps you plan, pay attention, and keep yourself organized. In another study conducted at University College of London, they examined the link between arts engagement and mortality, right? And mortality in over 6,000 adults across the UK, across various socioeconomic brackets, across ethnicities, and they examined what was happening over a 14-year period. And they found that 3 to 4 hours of receptive arts engagement was linked with greater longevity at the rate of about 31%, even when controlling for socioeconomic factors. That's pretty substantial, and that should, perk up our eyebrows and get us really curious about what's going on there, right? We've also known that, for over a decade now, that viewing visual artwork that we find captivating or that we find pleasurable, and this doesn't mean that we have to find the themes in the work to be positive, but just that we're engaged, right? That this can stimulate the release of a neurotransmitter, dopamine, which is connected with pleasure, with motivation, with pleasure, with learning. It can increase oxygenation. It can lower cortisol, which is our stress hormone. And of course, context matters, right? When and where and with who you view art will, of course, have some impact on your experience. Our colleagues at Artis, which is one of the labs affiliated with our Jameel Arts and Health Lab network, have just conducted a really high-level review of the best evidence we have around the impact of viewing visual artwork. And they found that most studies tend to focus on overall well-being or emotional regulation, a number of different areas. They found some interesting evidence related to social connection, which is really vital, especially given our crisis of social isolation. Some would really frame this as a crisis. But one of the most interesting findings they had was that, the arts allow us to make new meaning, right? And you spoke to this a little bit. This is not too surprising. Over a decade ago, a colleague of ours, Ed Basel, he's a computational cognitive neuroscientist. He'd written a lovely paper that others have written about this as well, that when we view visual art, we activate something known as the default mode network in our brains, right? And this is the area of our brain that's associated with daydreaming, with mind wandering. Essentially, we get to wander around unlimited, and daydream and allow ourselves to dissociate and to reassociate, to dissociate and to reassociate. And that allows for new connections to emerge in our minds, in our hearts, in our bodies. We connect our emotions, our memories, and we come away with new insights, new possibilities, new creative engagements. So that's some of the evidence. I think I'll pause there for sake of time.
Yeah. No, it's me coming from the art world, and when I started working with Nisha and she started showing the science, it really is fascinating and extremely compelling, and the evidence is there. It's not like the evidence isn't there. There's lots and lots of researchers in universities, but we find that there's a silo in the art world, we can see it, and there's a silo in the science world, and there's a silo in the policy world. So we didn't get to these slides. This was around youth mental health. Maybe we'll talk about that later. This is an Olafur Eliasson thing looking at environmental health. So Refik, okay. So I have my opening question to you is very simple. In your work, you're actually bridging evidence and data of science with expression and aesthetics of art. So what is that process? And I know we've got some videos behind while you speak.
Yes, I would like to show the next one. So just for everyone, I've been working with data as a pigment since 2008. I do believe that data is not just numbers, it's a form of memory. And I do believe that that memory can take any shape, any form, any color, any texture. It's, I think, this artistic human imagination that I think that take that numbers to any world. I also believe that when we do our work from heart, we have a chance to touch someone's mind and soul. And 8 years ago, unfortunately, I learned that my uncle diagnosed by Alzheimer's. And that's when I learned about this disease. And since then, I have been thinking very deeply about how important the memory itself, but not necessarily social media or like these synthesized memories, but the true human memories. And since then, I have been recording and understanding how to visualize the idea of a moment of remembering, to celebrate such a delicate, such a human instinct, an important thing. And here in the Melting Memories project that we were very fortunate to work with Adam Gesley from UCSF and Rosalind Picard from MIT to transform and more than 800 people's EEG recordings of the moment of remembering, to find the moment of remembering and transcode into an art form. The piece opened in Istanbul almost 7 years ago, and we received 100,000 audience. And they felt so connected with the piece in a way that was not necessarily looking at just scientific context, but a kind of a more emotional, more spiritual context. And in our next maybe slide, we did much more dive into the Human Connectome project. We can lower the sound a little bit maybe. For Venice Biennale architecture, we were very fortunate to work with the Human Connectome project, one of the world's most incredible open source data about human mind. In my work, I tried my very best to bring inspiration, joy, and hope to our work. And in this project, we were able to work with the entire Human Connectome project data and let AI to understand the feeling of inspiration, the feeling of joy, the feeling of hope, and try to transcode them into a form of architecture that perhaps one day we live in our best memories in our life. I do believe that when we collide art, science, and technology, there's a profound chance that we can make invisible visible. We can find human in non-human. And I do believe that collaborations like how you mentioned, how profound research shows that, yes, art is already healing us. And I think that there's so much possibilities when these domains comes together. And similarly, if you have a moment to see our work with Turkish Airlines here outside, you will be able to see similarly the power of travel. It's the discoveries that in life that when we never go before, that can even create a similar impact. So I'm so grateful here today with you all to share with the evidence of the science. So I'm very grateful that it's not just a beautiful shiny pixels, but they have a profound impact in the human mind and soul.
I mean, when I saw that last video first, because I'm often listening to the scientists, but without any visuals, and also not understanding the process. So this understanding what's happening in the brain and visualizing it, and you put it in this kind of digital interface with these different compartments. I think it's very, very important, that role of the artist as the translator of the science, and take the layman on that journey of what's happening in the brain and around memory and Alzheimer's and dementia, neurodegenerative diseases. Nisha and Chris, that's one of the strongest areas where the arts has been proven to have a measurable impact. Debbie, you touched on it before, but Hauser Wirth has kind of carved itself quite a unique place in this ecosystem, not going the conventional path. It seems quite intuitive, and especially in terms of what you're trying to do to impact society and to wear your values and your mission on your sleeve and moving into the healthcare space. Where does that come from, and what is that mission?
Well, I think to steal everybody's words, it's about care. And it's not a strategy, it's a human compulsion. Care and well-being is vital, and if we don't feel well, we don't work hard, we don't cope with things, and we don't survive. So for us, it's a natural part of what we do. It's something that we've always done. I think that it was probably made more visible as a result of the pandemic. And I would say that at that point, we, as a business, made visible a new role, a global head of environmental sustainability, as well as giving a lot more visibility to our active learning partnerships. And part of those gestures were also looking at long-term relationships and the relationships of those partners that we were forging or already had, or the relationships of new partners that we were going to work with, scientists, for example, the people who weren't the storytellers exclusively that we might be seen to be. Bringing those things together was going to make a difference to the way we understood what we were already doing, actually. And so I've got a few images. We'll stick with this one for a moment. And many of you know we have galleries in many locations. This is an image this summer in our gallery in Menorca, where we have an Eduardo Chida and a Ronnie Horn exhibition. And these are elderly people in a care home. And every care home in Menorca had the opportunity to take part in a workshop and make their own sculptures that were a homage to the sea. So this elderly lady is making a sculpture out of materials that have been found on the beach by an organisation called Plastic Free Menorca, who clean the beaches, looked after by Menorca Preservation Trust, which is one of our partners. Our project that brings learning and wonderful, hopeful experiences to all ages also makes visible the powerful work that another partner are doing to protect the environment. So it's just one example. There's another. I'm just going to give you 3 little examples to set the tone. Jenny Holzer, we've all seen Jenny Holzer next door. When she had her exhibition with us last year, we worked with Institut Arts, which is an organisation that looks after deprived children living in downtown LA. And Jenny Holzer asked them all a question. And it's a really good question. I'd beg you to all think about what your answer would be. Jenny said, what would you like to say to other people to make life better? And these posters are, the 13 young people who took part all produced their own truism and had it fly posted across Los Angeles. And then finally to Mark Bradford, for whom, a lot of the work that we do is driven by Mark Bradford and his values. So he's a really important ambassador for the learning and partnerships that we do and his care for others. And I think, the key point about whether it's the legacy of an artist like Eduardo Chida, Jenny Holzer, or the power of Mark Bradford, these projects are all artist-led. They're all artist-led and they're all artist-driven, but they go into realms and parts of the world that you might not, cleaning the ocean. How do you make that connection to Eduardo Chida? So it's a very interesting and creative approach to supporting partners, to making better for so many other people. And I think that those artists we serve those artists as a gallery, and we care about their well-being. When we do projects like this, they also have an impact on the whole gallery community. But then also, as you've seen, with these high school kids in Los Angeles, with the young people in LA and the elderly people in Menorca, it's all communities, it's all ages, and it's all backgrounds. So it's a kind of a secular nature as well, because it comes back round. And each artist was going to bring a new vision that each new audience is going to work with in a different way. And those partnerships, who knows, whether it's cleaning the ocean or looking after elderly people, they're all causes that need that visibility. So the power of the artist can also give visibility to an organisation that's doing the good. We're not doing the good. Actually, they're all doing the good work.
Well, I think, we follow Hauser Wirth, a lot of us in the art world, and it is almost like a museum, these big galleries. You have multiple locations, you have often more resources. I'd be interested to know, but I won't ask now, about how the business model works, because we know how much value/money is represented out there and how much challenges/lack of money there is in all these challenges. But let's move on to the museum perspective, Nathalie. So you've kind of been in the museum world, but you have pioneered the collaborations between museums and healthcare workers. So I know we've got a few slides. Just tell us about your experience of the museum's role in community health.
Well, in fact, I would say that, of course, here at the Art Basel, as an art historian and curator, I used to come here very often. But being with you, I understand that you are not here just for collection or not just for speculation. You are here because you feel art and you maybe feel in love with art. And this is exactly what I felt. And I still feel when I am facing art. And in fact, this effect is understandable, okay, in a scientific way. And this is why in many museums, I'm a museologist, now more and more I can see the big difference 1 decade after the pandemic and after all those researches, after all those initiatives with museums more and more around in the Western area, but also in North America, but also in England. They were really true pioneers for social prescription. We can see that museums are much more for conversation instead of conservation. And this is what we can see here with this slide. This is in the Palais des Beaux-Arts de Lille in the north of France. You have this huge atrium with 500 persons who are doing some yoga. Donc this is more about the caring museum, how the museum can care about you, how the museum can care about the citizens. So this is one example you may know. This is another example, which is very interesting because here, in such case, there is a strong collaboration and partnership with the French blood establishment for giving blood. And you can see that once a week, a month, sorry, there is this presentation and this practice within the Old Masters Gallery of the Orléans Museum of Fine Arts. It's the center of France. And it's not just because it is beautiful, it's also because it is relaxing, not just for the donors, but also for the caregivers. And this is a very interesting partnership which is made with the doctors. Another example, this is what you can feel when you are facing a work of art. In fact, your brain will interpret the painting, in such case, the self-portrait by Rembrandt, as it would be something alive in your brain. And this is explained thanks to neurosciences. It's because of your cell mirrors. It's because of the way how you interpret this painting when you have a positive aesthetic emotion. And there is two effects. First, the neuroplasticity, and second, the fact that you have some hormones, as Nisha says, dopamine, serotonin, etc., etc. So we can see that the impact of seeing, of loving a work of art which please you has a true positive effect. And when I was in Montreal, and still now, because I teach for the École du Louvre, Institut National du Patrimoine, for the University of Lyon and the University of Montreal, we always work with doctors and with scientists, and we can see that there are evidence. This is another example.
Nathalie, I'm just going to interrupt there because the end of care life, a lot of people are talking about elderly. There's a statistic that we should just reflect on, which is that we heard in one of the discussions in the research committees with the Lancet, which was that 25% of global healthcare funding goes, broadly speaking, to end of care life. And a lot of that is around pharmaceuticals, it's around technology, it's around palliative care, but the meaning making at the end of life, when you look at this one, which was a charity that takes people who are at the very end of their life to have one last wish, that meaning making that connects the family to the person that's about to pass away, and the amount of money that's spent on the technical side for end of care life seems like a huge opportunity for the arts in that particular area, but we see it again and again.
It's true.
Yeah. By the way, we're all going over time, so I promised myself I was going to be strict. So I'm going to give you another 30 seconds, Nathalie.
So,
Even though I interrupted you, which is very rude, sorry.
this is an example of a pilot project we made in Montreal for elders with evidence and with analysis. We work with the Jewish hospitals and with the Excellence Center for Excellency of Longevity, and many other examples with the Louvre, who also export and works within hospitals. So this is in Fontainebleau. Another incredible example of a mobile miniature museum, which is conceived especially with nurses, with doctors, and for patients, here in the Center for Psychiatry and Neurosciences in Paris. And?
That's it.
Oh, you didn't put the Yazidi.
Oh, no, that's the second question. Later.
Oh, good.
Yeah.
Okay. Great.
Sorry.
Okay,
Yeah, we're actually, we're running quite over, so we're going to have a rapid fire second round. Is that okay?
Yeah, I'll just talk really fast.
Okay. So, Debbie, I wanted to dive into some of the actual artist projects, two in particular. So I'm going to start off with one of my favorites, the Martin Creed.
Okay, well, this is included because it's Stephen's favourite, actually. But it's a nice place to start. I will try and talk very swiftly about this one. This is on the side of a farmhouse, which is in our Hauser Wirth Somerset location in the UK, which we opened 10 years ago, actually. It's just celebrating its birthday. But it's our first cultural centre that brings together art, learning, landscape and hospitality. And I think actually that continues this theme about well-being and looking after. And what was central to that project, and I was lucky enough to start working for the gallery at this point, was that connectivity with the community and looking at how we can bring our artists through our residency programme closer to connect to that community, for example, and how we could work with schools, how all of the things that we worked with would better the experience for all, and all for free, I think is really important, so a massive gesture. And then during the pandemic, obviously Martin Creed's piece, Everything is Going to Be All Right, a self-soothing comment or something that really taps into an artist who understands the human condition, became a very powerful tool, and he installed it in many public places, from the Tate Britain to Rennie Collection in Vancouver to here outside Braemar Castle in the Highlands of Scotland, and it has been exceptionally well received. Was that quickly enough? Moving on. Hospital rooms. So this is actually a gallery install a couple of years ago in our gallery in Savile Row in Mayfair in London. A partnership with Hospital Rooms, which is a very special organisation. We're going to hear from our colleagues a little bit more about this, and thankfully the science, so I'm just going to tell you the story. Tim Shaw and Neve White founded Hospital Rooms because they went to visit a friend who'd been sectioned. And that experience had a dramatic effect on them. And as artists, and coincidentally having met both working at the gallery in their previous roles, they set up Hospital Rooms. So Hospital Rooms is an organisation that works directly with artists to bring art into hospital environments. We have always supported them by hosting their annual auctions, but in the spirit of our sort of new direction of partnerships, we looked much further at how does our relationship grow over time, and what more can we do than host an auction. And during the August months when the gallery was closed, we gave them our spaces to have pop-up exhibitions. The piece at the beginning by Mark Titchener, Like There Is Hope and I Can Dream of Another World, was also a mental health patient said that to the artist, and he used that as the piece that he painted directly onto the gallery wall, that was then temporarily installed here at Norwich University before going on to be installed at Norwich Hospital, which is a new build. The whole transition of that artwork from gallery to hospital was funded by the profits of the auction that we hosted that summer. The other images are of the project the following summer, and Springfield Hospital. So I'm going to give you some little facts here. So Springfield Hospital, which is a new build, and we see two projects here installed in the hospital, and you saw a previous slide of these works also in the gallery space. So we work with hospital rooms. We gave them visibility and support. They gave us visibility and support. Our staff learnt about mental health. Our community learnt more. Our artists got involved who didn't know about that organisation before, and new people came to our gallery who hadn't been before. So it grew a community. Our community then went to Springfield, and we all, the staff, went and visited the place ourselves and saw the artwork in situ. Springfield Hospital has 20 artists involved in its new build, and it has run 120 workshops for medical staff, families, visitors, and inpatients. And their recent project this year, Digital Art School, has just won an award, so they're going on from strength to strength to strength. And we're very proud to be involved, and I'm sure Nisha's going to give us some of the science about it as well.
Yeah, we'll move on. One comment I'll say, because
Okay.
as artists, I graduated from art school. I had quite a few friends that went into psychiatric care. And the way Tim and Naima describe going to see their friend, and they talk about the brown furniture, the neon lights, and they couldn't believe that in the most fragile moment of their friend's life, that someone had designed this awful, hostile place. Very logical. I had the same feeling. But it took an artist, the antenna, to identify that and then formalize it, and then a gallery like yours to support it. So I think it's a very profound project.
And I think that artist antennae is very important. It's the quality of the artwork as well. That, doesn't matter who you are, you deserve access to good quality artwork, and Tim and Neva are really great at bringing that level.
Right.
Yeah.
And Nisha will tell us about how that project now is part of a very significant study.
Well, I mean, it's just such a beautiful project and such a great illustration of artists really being partners in health, artists as health producers. And I still want to lift up that, we're speaking about arts and health from the frame or from the lens of the role that artists can play, the role that gallerists and museums can play. And we also want to lift up what Chris had mentioned earlier, which is that we are all artists. And at the same time, in times of where we don't feel a great sense of beauty, that beauty can in fact be healing, that we want to lift up aesthetic accomplishment along with social efficacy, and we can see a real tight weave between these two. So inspired by the work that Hospital Rooms was doing, the question that is at the heart of Hospital Rooms is, what can a hospital look like, right? What is a healing environment? And we saw that the practices that they were engaged in, namely engaging artists to listen to patients and listen to community members and listen to staff, and then translate some of these ideas onto the walls to beautify this space, to dignify this space, was also happening in New York City Health and Hospitals. It was also happening in Lagos University Teaching Hospital. It was also happening in a children's hospital in Slovenia. And I am sure that you are probably very familiar with other spaces in which this practice is happening. So we got curious about what's going on there. I mean, often it would seem that hospitals are not necessarily waiting around some hospitals, because what Stephen said is absolutely true. There are many quote-unquote healing environments that really fall short of that, but that some care spaces, we're not waiting for the evidence to proceed in this direction. But what if we could establish the evidence base for this? So now we have this, the largest, first of its kind global study looking at these 4 different country sites and essentially evaluating what is the impact of these murals on patients, on staff, on care providers. And we're starting to look at relationships. We're at the beginning of this evaluation. So I'm just going to share some of the questions that are coming up. So for example, can we correlate the presence of these murals with length of stay, or with staff retention, or staff satisfaction, or patient satisfaction, right? Can we take a look at how patients report their general well-being in spaces where there are murals in comparison we don't have those murals. So we've conducted a initial what's called an evaluability assessment, where we've interviewed staff from each of these 4 sites to get a sense of what do they think is going on with these murals in each of these spaces, and other stakeholders in each of these 4 sites, and that's now leading us to identify the right kinds of measures, the right kinds of scales, the right kinds of questions that we can now ask at each of these 4 sites. And we hope to be able to share the findings late next year, around October of next year.
Thank you. Now, Nathalie, another really interesting project that we collaborated on, which I didn't forget it, it's here, was around post-conflict and those that have been through a trauma or a very, very difficult thing. Now, you work at the Institut du monde arabe, which has a focus on a part of the world which, unfortunately, has many conflicts and many people going through these extreme situations. Could you just talk us a little bit about the project you did with us in northern Iraq, the Yazidi Cultural Archives?
Yes, I would say that I work for the Arab World Institute in Paris, and of course we work with 22 countries and with all the kind of diasporas. Here, of course, I have to to be very grateful towards United Nations, Google Arts, Jameel, Culture Runners, and all of you, because thanks to you, we were able to launch at the Institut du monde arabe 2 years ago this very, very powerful project concerning the genocide in 2014 in Iraq with the Yazidi 16 women. And in fact, thanks to art, thanks to the recognition on the Google platform, they were able not just to communicate about their trauma, but also to be recognized for what they are as women. And it is a very, very unusual and daring project, which I think has been very strong, and which I think you will continue in other difficult places. So it's true that this concern about art and health could be also in all kind of places. It's not just in museums, it's also the way how you can use art with art therapy, not just with museum therapy, because art can help you in order to communicate your emotion, your trauma. And we know that in such case, those women were facing Daesh, but we know that in many other countries, for example, in Africa, there are the same kind of use with art therapists and doctors who help young children or all kind of women, men who are in such a very, very difficult and traumatic situation. So it's a very important project, and I've been very honored to be able to launch it at IMA.
Well, I think what this project was about collaboration, because so what happened was these women had been through, they were actually captives of Daesh, they had been abused, they'd been through something absolutely horrendous, and there was a series of art workshops, photography and art workshops that they went through. But then, though the contents, the results of those workshops, their art, their photographs, were put onto a permanent archive on Google Arts and Culture on the UN homepage of the Google Arts and Culture, which the UN do not use very much, which was interesting. And the idea was, if we recognize their stories at that high level, can that have an impact in them building back their mental health? And now Nisha and NYU are doing the study of that project, which is where I think the silo breaking is important. Yes, we can do a one-off project, which often happens in the world of philanthropy. Oh, this is terrible. Let's give some money. Let's do the one thing. But with the collaboration with the researchers, you evaluate it, and then through Chris and the WHO to present that to policymakers and say, this is a model. This can be taken to other areas. And I think that's the model. So jumping nicely on through the collaboration theme, Refik, to end us off in terms of the questions, you're famous for collaborations, and could you tell us about two collaborations that
Yes.
you've done quite recently. And at the sound at the back, if we could have the videos down a bit, so
Yes.
if we can, yeah.
So first of all, I'm so happy to hear many artists also supporting the cause and hospitals. And as an independent artist, I don't have a gallery representation, but as a studio, we use our blockchain as a form of power to bring our society together. 2 years ago, we worked with the SpaceX data and raised $2.5 million for St. Jude Children's Hospital, and we were able to pay the entire hospital's entire costs for at least one day for the whole families. And these pieces are from last year. We were very happily worked with the Lausanne Hospital and visualized 5 children's brain signals. They were healed through their disease. And technically, this data set was a HOP data. So we transformed them into a data sculpture and auctioned at UNICEF for 1.7 million euro. That's how we support not only just create an AI and data sculpture, but also use blockchain and bring society together. But we were able to take attention to the cause and also bring one of the, as far as we know, the largest donation to the cause, that our work, research, and the science, and the blockchain community came together to support the thing that we believe very important. Sometimes our art community has very much bias about the AI and blockchain, but I'm happy to say that when they are used rightfully, they can have a profound impact, quantifiable impact. And the second project, I think that...
Just pause you one there, because I want to say that thing about one artwork raising that much
Yeah.
money. I'll give you another example. That Agnes Gund, when she donated one painting that changed criminal justice reform in the US, it was over $100 million. But one artwork out there can change an entire
Yes.
area, you know,
Yes.
and an entire theme. And I think it's something for the commercial art world to think about. It's not about giving everything. It's not even about giving 1%. It's about recognizing that, you know, your generosity, that's a significant amount of money for like hospital rooms or something like that. And if that becomes a model, then that, you know, changes healthcare.
Absolutely.
Sorry.
And tangible, it's transparent on blockchain, so it just really questions everything. And the last project, I'm so happy to share that, again, as an independent artist, being at MoMA was a big honor. And we opened our exhibition end of 23, and we had this profound moment. The piece was using 138,000 collections of MoMA. It was the first generative AI piece in the GAN lobby. It was a 2 years communication and collaboration with our curators Michel Coe and Paolo Antonelli. And the MoMA is a very important museum for living artists, and I think it was a deep honor to be able to show an artwork to represent the communities of all the heroes and giants in that archive. But what was very special, we received close to 3 million people. And it was a fascinating feedback every single day, coming from all type of people. And I have been very close with the securities and the carpenters and the art historians in the museum, and I have been like sending so special photos. And what was fascinating is, even though the art may be here, not necessarily campfire, but it brought together close to 3 million people. And what was fascinating, average viewing time was 38 minutes. Because the piece has a camera and a microphone and a weather station, it was sensing who we are. There was a dialogue. And that data was so powerful that we asked the question, why 38 minutes happen in 1 year for almost 3 million people? And we also tried to measure the brain signals of 36 people and try to measure their brain signals and the heartbeat and the skin conductance to really measure, is it really possible to create that effect on a safe and secure space and demystify AI, showing how it works, where data comes from, clearly explain the work behind the scenes, and still create that kind of an abstract, but still touch the mind and soul of the people. And what was very fascinating to me is it's very possible using museums and large organizations create this positive impact through art. And one of the messages that I got from one of these almost 3 million people, and this person said, Ricarda, I just lost some very dear people to me, and looking at your art made me feel very close to them and made me think a lot about life itself. I have never before felt so impacted by a piece of art, and just want to say thank you for what you created. It's beautiful and mesmerizing and gave me peace. I do believe that if it's not art, what is art? But when the art touches mind and soul, I think there's a profound effect. And I think you are quantifying, scientifically, which is incredible. And I'm so happy to say that sometimes the technologies we don't think that may be powerful, we can turn them into a powerful healing environments. And I think when artists have a chance to demystify AI, cutting-edge technologies, there's a whole healing in that context.
Thank you so much, Refik. We all know that piece, we all read about it, but actually to understand that there's a data set behind it and all this stuff is really interesting. I have not done a good job as a moderator because we are way out of time, but I wanted to leave a little bit of time for questions at the end. Before I do, I want to thank our panelists. Thank you, Nathalie. Thank you, Debbie. Thank you, Refik. Both of you have met for the first time. Thank you, my dear colleague, Nisha. And invite you all to follow this journey that we're on collectively. The Healing Arts is a platform that's part of the Jameel Arts and Health Lab. After Basel, which we hope will be a longer-term partnership, we're going to Scotland for a national activation, over 100 events across Scotland in August, between the 19th and 23rd of August. And to get everyone's energy up, we've got a little trailer, 1-minute trailer, with a song by Bronski Beats that was given to us because it's 25-year anniversary from when that song, those of us who were 90s kids will remember that song, because it's about a young gay man with a lot of hostility around him finding his way in the world, and we're framing it around social health. So here's our trailer for Healing Arts Scotland. Very short. So great. I don't know how much time we have for questions. The Art Basel white uniformed people will tell us, but first question here. Thank you.
Hi. I think, well, I've spoken this with Refik and before and Efsun. My name is Johanna Suleta, and what I would like to connect more also within the healing is handwriting. So one there to think to be included maybe for a collaboration as well.
Okay, a comment, not a question, but that's great.
Well, or if you're already measuring handwriting as well as part of the healing and as part of the process of art making in which every person can be encouraged more too. I don't know if that's already in the program.
I would say it's not in a current study, but in the evidence that we have, art therapists do focus on mark making of all kind, whether it's writing or whether it's painting, whether it's drawing. So I'm going to have to think about that as it relates to maybe an upcoming project. But I do know that it's there in the evidence that we have collectively.
Yes, and maybe a project with handwriting and Refik. So.
There is a lot of conversation around the arts and what is within that arts, like gardening. There's a whole conversation going on about gardening, which is interesting. Oh, is it like being moved off by the awards ceremony?
15 more minutes. Yeah.
Oh, we're about to close. Any more? Oh, at the back.
I just wanted to say thank you. That's you did an amazing talk. And I wanted to add that I think with all what you said, it's also so much, it's not only healing the patients in the hospital, but it's also through that healing democracy, I feel. Like it's a very, it's so much bigger, these attempts to coming together. So thank you so much for all your work. Thank you.
Mm-hmm. I mean, one thing I didn't get to mention earlier was that, with the studies around youth really speak to youth who engage in the arts more, have a higher level of civic engagement. But you're absolutely right. When we create the conditions for real participation, we're modeling it at a microcosm what we could be doing at a macrocosm. Yeah. Thank you.
And in fact, I would say that we talk a lot about the cultural democratization, but there is also sanitary democratization, and both can work together, obviously.
Hello. A question, also following on the democracy theme, which is that one of the sort of dirty secrets of arts and museums is the whole, 80, 95% of the collection is hidden, stored away somewhere. There are great places like hospitals and other places where these pieces of art can heal and be useful. Beyond murals, how have you investigated, and what do you think is the the place for physical pieces of art that aren't permanent?
I will say in the New York City Health and Hospitals, one of the partners in the hospital, in the home project, the hospital murals evaluation, that they have really created, I mean, one of the largest collections of art in New York City is in the hospital system, that they have put up both screens, physical art, as well as murals, so there's art of all kinds, but I'll turn it over to my colleagues to talk about the role of museums in that.
In fact, for example, I used to be a vice chair of the Canada Council for the Arts, and there was a bank for arts, which allowed to have loans in hospitals or other places. So this is a possibility. I would say that when we have works within our collection, of course, we have conservation issues. So it's true that even if we do have some works in storage, we must say that the main percentage concern graphic art or photographic art or fragile works of art, which cannot go outside or cannot be on display. But it's true that there are more collaboration in terms of video art, in terms of reproductions, etc. We could do, for example, like the Louvre, but there are many, many other museums who also collaborate with hospitals.
And I wanted to say that whilst we don't have a collection as a commercial gallery and we don't put work in other settings, our artists are incredibly artists are generous. And we have to remember that that is an artist's living. We shouldn't expect artists to give their work away for nothing. It's their living. So we should always keep that in mind as well. But I would also say that in 2022, we ran an auction, and many of our artists and actually it came out of our artists' requests, an Art for Better initiative, where they donated artworks, and our auction raised $4.5 million for the refugee crisis. And again, it was driven by the artists themselves, and I think this is really important as well, that we shouldn't expect of them, but we should celebrate when they generously decide that this is what they want to do.
And one more, maybe a perspective. We are working with also 3 hospitals, but in fact, like adjust and maybe conventional mediums, we are exploring the idea of an AI as an assistance through the nature. So we are creating an open source AI model that will be used in education and research, large nature model, and we are exploring the idea of literally in a world that when we cannot go nature, can nature come to us situation, and we are exploring the idea of generative reality through AI. And there's so much possibilities of like bringing complex technologies in a much therapeutic context of AI, and they can bring an extremely, I believe, healing sessions and context.
Thank you so much. It was a very fascinating discussion. While we were speaking about more healing and hospitals, I was just wondering, I work for a pharma company here in Basel that supports art. And I was just wondering and curious about preventive healthcare or pharma in general, and are there any live projects that you're supporting, or what's your take on it?
I would say on the preventative care, our work is concerned with health promotion, as well as the treatment and management of various conditions. So it's across that spectrum. I'll pause there.
Mm-hmm. I want to add that, of course, we don't know if art can save life. You didn't ask your question.
Ran out of time.
But I want to answer.
Sorry.
Because what is important is that with art cannot replace art medicine, of course, but art can help you, because the medicine now is understood within an holistic vision of our body, of our health. So it's not just a question of healing a symptom, but it's really the question of healing a person. And this is how art can help you, considering the whole person. And this is very, very important in terms of supportive care. The supportive care belongs to this holistic vision of medicine, which is now understood that a global medicine.
I think we're here in Basel, which is a pharma and a technology health hub and an investment health hub. I think the business of health is very complicated from our perspective. So if you're a pharma company, you will develop something, and around that you will have an advertising campaign, you will have lobby groups, you will have studies and evaluations. But let's say that there's strong evidence that an arts intervention has impact on an actual disease state where there is a pharmaceutical and against it. You're going to have, you know, a complete David and Goliath struggle to push or to say that this thing. And also you have the insurance. If you're in America, you have the insurance industry. So we talk about that. We talk about, well, in a way, the Jameel Arts Health Lab has a structure through the relationship with the WHO to take that evidence up to ministers of health and ministers of culture. But the business of health is a fascinating, you know, world. And there's also stories in the art world where they've become in conflict, like the Sackler, where the art world led a powerful campaign that took down $1 billion company with a pain drug that was seen to have all these side effects. So it's a fascinating area. It's one that we have to be very careful of, but it's also one that we should talk about.
Okay.
This has to be the last question, I think. Yeah.
Thanks. My name is Miriam Burrier. It's a pleasure to be here. I've been very inspired by your conversation about all the possibilities beyond what's usually seen in the arts space, and especially the art sciences intersection. Myself, I'm a medical doctor and a professional violinist, and went through global health training, and actually now entered just the space and global health context. And I would like to share that we are already thinking about using AI-enhanced approaches to actually conserve information from nature, to bring it into the music sphere and the arts as well, and then also leverage it to space, to the space sector, to enable possible future missions and habitats beyond this planet. And I really much agree with the visions that also Mr. Anadol has been talking of. It's been really beautiful, and I'd love to talk to you about this.
Yes.
It's another comment. I actually think that we have to go.
Yeah.
I really apologize. Sorry, we have to, because we're actually hosting something that we're potentially late for. So thank you very much, Art Basel. Thank you very much to the audience, and please follow us. Please follow the work on the website and social media, and have a good rest of the day. Thank you.
Thank you so much.